Here is Dr. Sreedhar Potarazu, who's been a critic of Obamacare right from the get-go. Now, sir, if we add together the PricewaterhouseCoopers study and the McKinsey study which came before, seems to me that we've got an Obamacare situation that's just unraveling because it's going to cost a great deal more than we thought, and you can't keep the policy which you wanted and which you liked in the first place. What do you say?
Stuart, I completely concur. We have a crisis of enormous magnitude that has now surfaced that causes me great concern. The numbers that came out in the McKinsey study as well as in the PwC study are staggering. For those of us that get coverage through the workplace, if you look deeply within those numbers and you look at the rise in premiums above the 8 to 8.5%, anybody that understands the economics from an employer coverage standpoint, above 7% is when employers can no longer absorb the cost of health care just by growing revenue. That sends off a fire alarm in terms of the fact that they're going to raise premiums, they're going to raise deductibles, they're going to raise co-payments, or they're going to stop providing coverage altogether. So that anybody today that is watching this, that has enjoyed the benefit of getting coverage through your workplace, should be highly, highly concerned, because the statistics show us that many of us are not going to have that privilege any further.
I think we've got a dollar number on how much extra it's going to cost the taxpayer because of Obamacare. Hold on a second, Doctor. I think, Tom, you got a number?
Yeah, I saw two different numbers, but it was $400 billion, and the problem we're having is we don't know if it's $400 billion a year or $400 billion over 10 years, because so much of this is over 10 years, but it's going to increase $400 billion. And I've got to tell you, Doctor, I think this is a conservative estimate. And one of the things that they come out about is they say, well, the White House did a survey with RAND, and they did one with the Urban Institute. But what I saw from both of those surveys, RAND and Urban Institute asked individuals what they thought if their policies were going to be dropped. What PricewaterhouseCoopers and McKinsey did was ask the employers if they thought they were going to cut the coverage. Big difference.
Correct. And
yeah.
Right. There is a big difference between the initial CBO estimates of 7% of folks that may end up going to the exchange based on the results of the PwC study. I think the bigger issue here also is in terms of how much this is going to impact in terms of the deficit and the ultimate cost of the bill. Remember that the whole notion of getting everybody covered through insurance was to minimize the number of people that would end up in the emergency room and not have coverage that was apparently driving up cost, and that was the notion. What's happening here is that most people who are not going to get coverage through their employer will end up in the exchanges where they're going to pay more for insurance. Interestingly enough, there's another loophole that was introduced yesterday that you may have seen, that if you're a middle-income retiree, guess what? You can now qualify for Medicaid and potentially even get food stamps. They've got to go back and fix that. So every week you are finding mistakes in terms of the economics of what the CBO estimated in terms of the potential savings that are completely flawed. But we have, to this week, Congress and the Senate must stop the funding of this bill, because every single week we come back with flaws in the financing and the basis of these metrics, where we are completely bankrupting the country and companies in terms of the economics of what we were told.
All right.
And every week I'm back here on Fox talking about this, and we have to stop this madness.
All right. Those are interesting last words. Dr. Sreedhar Potarazu, thanks very much for joining us, sir. We do appreciate it.